development, histology, and few clinical aspects. First of all, it is located in pectoral region. It is an accessory organ of female reproductive system which provides nutrition to the newborn in the form of milk. It lies in the superficial fascia of the pectoral region. It is divided into four quadrants, namely upper lateral, lower lateral, upper medial, and lower medial. The axillary tail of Spence. It is an extension of upper lateral quadrant into the deep fascia. The opening is called as foramen of Langer. Base of the breast is circular and extends vertically from second to sixth rib, horizontally from lateral border of the sternum to mid-axillary line. The breast lies in the deep fascia covering pectoralis major, serratus anterior, external oblique muscle of the abdomen. The breast is separated from the deep fascia by retromammary space. Nipple present at the level of fourth intercostal space, 10 centimeters from the midline. The nipple is pierced by 15 to 20 lactiferous ducts. The skin at the base of the nipple has a circular pigmented area called areola. Areola is rich in modified sebaceous glands, particularly at its outer margin. These are enlarged during the pregnancy to form tubercle of Montgomery. Oily secretion of these glands lubricates the nipple and areola, which prevents crackling during the lactation. Suspensory ligament of the Cooper, which anchors the skin and mammary gland to the deep fascia. These ligaments maintain the contour of the breast. The fatty stroma forms the bulk of the gland except beneath the areola and nipple. Arterial supply is by internal thoracic branch of subclavian artery, superior acromiothoracic and lateral thoracic branches of axillary artery, lateral branches of posterior intercostal arteries. Venous drainage is by superficial veins drains into the internal thoracic vein, deep veins into the axillary and posterior intercostal veins. Nerve supply, anterior and lateral cutaneous branches of 4th, 5th and 6th intercostal nerves. Lymphatic drainage. 70% of the lymphatic drainage drains into the axillary lymph nodes, which includes anterior, posterior, central, lateral and apical groups. 20% of the lymphatic drainage drains into anterior interthoracic nodes. 5% of the lymphatics drains into posterior intercostal nodes. Few other nodes where lymph get drained from the breast are supraclavicular nodes, cephalic nodes, subdiaphragmatic nodes and subperitoneal nodes. Lymphatic vessels. Superficial lymphatics drains the skin over the breast. Deep lymphatics drain parenchyma of the breast, nipple and areola. There is a subareolar plexus of Sappi. It is a lymphatic plexus present deep to the areola. The anterior and central groups of the lymph nodes are commonly involved in carcinoma of the breast. When come to the development of the breast develops from ectodermal thickening called mammary ridge, also known as milk line or line of skulls, which appears during the 4th week of intrauterine life. It extends from axilla to the groin, but most of it disappears except at the pectoral region. The persisting part of the mammary ridge is converted into a mammary pit. The secondary buds, 15 to 20 in number, grows down from the floor of the pit. These buds divide and subdivide to form lobes of the gland. Entire system is initially solid but is later canalized. At birth or later, nipple is everted at the site of original pit. What are the developmental anomalies of the breast? Emastia, which means absence of breast. Athelia, absence of nipple. Polymastia, supernumerary breast. Polythelia, supernumerary nipples. Gynecomastia, development of breast in males, especially seen in Klinefelter syndrome. When come to histology, we are dividing into non-pregnant women, pregnant women and lactating women. In non-pregnant women, alveoli is indistinct, whereas in pregnant women, alveoli is present but empty. In lactating women, alveoli of various size and shapes filled with secretions. In non-pregnant women, duct, lobes and lobules are indistinct. In pregnant women, duct, lobe and lobules are well developed. In lactating women, ducts are well developed. In non-pregnant women, more of the connective tissue with fat cells are present. In pregnant women, connective tissue and fat cells are comparatively less. In lactating women, connective tissue stroma separating into lobes and lobules. When come to the clinical anatomy, clinical aspects of breast, the carcinoma breast is the most common in females, especially in postmenopausal women. As I have discussed earlier, breast is divided into 4 quadrants, out of which upper outer quadrant is the frequent site of carcinoma breast. So what is a sentinel lymph nodes? These are the first lymph node draining the tumor bearing area. What is the type of incision given in carcinoma breast surgery? It is a radical incision, radial incision. This is because to avoid cutting of the lactiferous ducts. Why breast become fixed in carcinoma breast? When cancer cells invades the suspensory ligament. As I have discussed earlier, these ligaments are responsible for maintaining the contour of the breast. Why there is a retraction of nipple in carcinoma breast? This is because of infiltration of cancer cells and subsequent fibrosis of lactiferous ducts. Why there is a PUD orange appearance of the skin in carcinoma breast? Mentioned earlier, there is a superficial lymphatics which drains the skin over the breast. When these cancer cells obstruct the superficial lymphatics, then the skin of the breast resembles like a skin of an orange, which is known as PUD orange appearance of skin. Why there is a spread of carcinoma breast to the other breast? Because of the communications of superficial lymphatics of breast across the midline. What are the investigations? The mammogram reveals the cancerous mass, and FNAC, which means fine needle aspiration cytology, is a safe and quick method of diagnosis. The few medical terms which we have to learn in anatomy are mastectomy, which means removal of one or both breast. Radical mastectomy, surgical removal of breast along with underlying pectoral muscles, lymph nodes of the axilla. Lumpectomy, which means removal of only tumor. So anything ending with ectomy means removal. Thank you.